Hi, I'm Linda Hindle, Lead Allied Health Professional at Public Health England. Well, I think this started really because Suzanne, who is the Chief Allied Health Professional Officer at NHS England, was going and visiting the Vanguard sites, and she kept being asked by strategic leaders as well as AHP leads whether or not we had a strategy. And I think that was the impetus really for her to start this piece of work around AHPs into action. I think that's the most exciting bit really, because it's almost been the process that's been better or as good as the final product, because it was created through crowdsourcing. So it's not been written by leaders in NHS England or anywhere, any of the other arm's length bodies. It's been really created by allied health professionals themselves and the people who work with them and the public. So what Suzanne did is she sat down with AHP leads and the 12 professional bodies to say what are the things that we need to be thinking about in terms of what allied health professional roles need to look like in the future. And they used that conversation to create some questions that then went out to all allied health professionals through crowdsourcing. So allied health professionals were encouraged to talk about what could be different, how AHPs needed to be different, how we needed to respond to the challenges that we're facing with the health and social care system now. So they generated lots of information, did some thematic analysis on that, generated it into some key impact statements, and then put them back out there for AHPs, strategic leads and the public to comment on, and that's how we ended up with AHPs into action. So I was involved as an AHP, a dietitian in my own right, just commenting and adding thoughts and commenting on other people's comments. I was also involved with Joanne Fillingham, who was Suzanne's clinical fellow in kind of shaping what the final document looked like. And I'd like to think that through my work at PHE, I've also influenced some of the content, because a lot of the content in the final document around improving the health and well-being of communities really resonates with the messages that we've been trying to create through our ambition for AHPs to be recognised as an integral part of the public health workforce. I think it applies equally to all allied health professionals, but really it gives us almost a blueprint for how we can develop our services going forward. And I think what's important is that the document is written really for strategic leaders in sustainability and transformation plan areas. So it's as relevant for them as it is for dietitians, and so it gives us an opportunity to demonstrate how we add value, and for those strategic leaders to see the value of dietitians. But it also gives us as dietitians an opportunity to look at some of the case studies that have either been submitted by dietitians, and there's some fantastic ones in there, but also it gives us an opportunity to look at some of the other ones that have been submitted by other AHPs to learn from the experiences and evidence that they've put forward. I suppose the first thing is to find the document and read it. Secondly, I would go through the case studies in detail, because as I said, they give really great examples of where we are having an impact or could have an impact. And thirdly, I think use the opportunity, the window of opportunity that we have now with strategic leaders, because this has spoken to those leaders, and it gives a framework for them to look at, are they involving allied health professionals and dietitians enough in their planning. But I would say as dietitians, we need to be going to those leaders, waving this document around and saying, have you seen it? It's got some great examples. Would you like us to talk to you about it? And I suppose in an ideal world, we as dietitians would be doing that with our other AHP colleagues, because what this talks about is the transformative potential of the allied health professionals, and it talks about us as the glue really that brings together the health and social care system, so we need to be capitalising on that. So AHPs into Action gives an opportunity for all dietitians to promote what they do. You don't need to be a service manager to use this. Whatever your scope of influence is, you can use this document. You can use it as a way of starting a conversation about what dietitians do well, how we can make a difference to some of the problems that managers have within their areas. So I think use it as a way of creating networks, as a way of influencing the networks that you're already involved in. Think about some of the good news stories that you've got already. Think about how you can work with your communications team to get those out. And if you feel that you're not able to have direct conversations with your commissioners, think about kind of what are the pieces of information that they might be seeing through other means, and can you influence those information trails, so Twitter, other social media, general media. So try and get your message out there, whatever way you can. If you can't go the direct route, go the indirect route.